Telemedicine, the Future of Electronic Healthcare by Melissa Galindo, Erika Hatch, Kaitlyn Harris, and Brianna Woodworth. When hearing the word telemedicine, what initially comes to mind? Do you think of telephones? Do you think of advertising medications over the phone? What about talking to doctors? How about robots playing doctor? Let's talk in depth about what it actually means. By definition, telemedicine is the remote diagnosis and treatment of patients by means of telecommunications technology. In simpler terms, telemedicine is the exchange of medical information between doctors and their patients by means of technology, so smartphones and computers, that will help make care patients are receiving better. This allows doctors to provide long-distance contact, care, advice, reminders, education, interventions, and monitoring without having to be with their patient.
Here's just a quick overview of the history of telemedicine. In the 1900s, Netherlands was the first to use this with the transmission of heart rhythms over the phone. In Pennsylvania in the 1940s, radiographic images were sent between two cities in Pennsylvania. In 2012, Virginia, the leader in telemedicine, reduced hospitalization of mental health by over 40%, heart failure by over 25%, chronic lung problems and diabetes by about 20%, just using telemedicine. And in 2015, they were able to provide 2.1 million consultants using telemedicine to over 677,000 veterans. Here's a few things to consider when hospitals implemented telemedicine: cost, liability, security of data, effectiveness, and equipment. Cost. This can be very expensive technology, so before the hospital was able to incorporate this, they had to budget for it and what the consumers would have to pay. Liability. Because your information is in the hospital's hands, they need to have plans of what to do if it were to get into the wrong hands. Security. It is very important to ensure that all of your private medical information is kept safe. Effectiveness. For this technology to be useful, it has to be easy for everyone to use and understand, or it won't work. Equipment. It is important to know that everyone might not have access to this type of equipment necessary to use this technology, and it is the hospital's job to make sure it is accessible for all.
Tiger, what is it? The education surrounding telehealth in nursing schools would not be as widespread as it is today without the Tiger initiative. Telehealth was not always as accepted as it is now. Tiger pushed for telehealth to be taught to those wanting to go into healthcare. This initiative promotes implementing the best practices in nursing schools at a fast and rapid rate. It also encouraged interprofessional care and collaboration between healthcare specialties to promote better patient outcomes. Tiger created an amazing community surrounding telehealth.
Telemedicine is very beneficial for treating chronic conditions. Such conditions should include diabetes, hypertension, irritable bowel disease, multiple sclerosis, etc. Since more than 133 million people are affected from chronic illnesses/conditions, telemedicine would allow doctors and providers to deliver them care on a day-to-day basis based on the needs of the individual patient. The provider could assist his patient in various ways, some of which include reduce the amount of time and effort patients spend on their own personal care, allow for a better compliance of treatment plans given to a patient, provide overall health, and create plans and goals for a day, such as creating meals, giving exercise demonstrations, and telling them when to administer medication.
Current usages of telemedicine in COVID-19. COVID-19 is a perfect example of how telehealth can be extremely beneficial to healthcare workers and patients. We know that COVID-19 is an airborne disease. Because of this, we all had to quarantine from other people, thus shutting down a lot of physicians' offices and limiting hospital occupancies. Telehealth is a way for patients to be in contact with their providers safely. This is extremely helpful to populations that are immunocompromised because it limits contact with others. Telehealth is also a fast and accessible way to receive updates on the pandemic and the restrictions and protocols surrounding it.
Like with anything, there are many pros and cons that could be considered with telemedicine. One obvious pro is the flexibility that it is offered. Having the ability to access the information literally anywhere helps to avoid the obvious restrictions some individuals may come across. For example, if someone were to be immunocompromised and have to go out to the doctors in today's society with the pandemic going on, it would put them at a greater risk of going to the doctor rather than just not going to the doctor at all. Another clear pro is that it provides the patient with extra comfort. Some patients, especially children, feel uncomfortable in hospital settings because the doctor's offices can be seen as a scary place. Having the possibility of talking to your doctor while being in the comfort of your own home can lead to patients opening up more. Direct support will give the patient what they need in a timely manner when they need it. For example, if a patient were to require support for choosing healthy meals, who has diabetes, they would be able to talk to their doctor while eating to ensure that their food choice is adequate. One of the biggest pros that it gives is the access of medical help to rural areas that wouldn't have access to medical help any other way. Telemedicine is also extremely efficient and will help prevent the patient and doctor having to play phone tag or having to schedule an appointment just to ask them a question. Finally, telemedicine can reduce the overall cost for the patients by avoiding urgent cares and trips to the ER. There are a few drawbacks associated with telemedicine. Since the meeting is online, it is hard to properly read the body language of both parties. However, you can pick up on facial expressions and the tone of their voice, which can be misinterpreted. The lack of privacy is also an issue when it comes to finding a quiet, private place to have an effective meeting with the provider. Tech issues such as audio glitches, slow internet connection, or a video malfunction can also occur, which may lead to the session being less productive. In addition to this, in order to become an active participant in telemedicine, it requires technological devices such as phones, tablets, or computers. Since not every person in America has access to these resources, this would be an impactful setback for telemedicine. A limited assessment may also become a problem because the provider is unable to perform a physical exam and is only able to perform a care plan from information being told to them by the patient.
The future of telemedicine is very bright. As we have discussed so far, telemedicine will be and has been extremely beneficial to management of chronic diseases and responses to global health emergencies such as COVID-19. Two main ways that telemedicine will affect patient populations in the future is the more accessible healthcare and reduction of healthcare costs. Telehealth has been very influential in the type of care that medical professionals are giving to their patients. With the past, current, and future advances, the possibilities are endless. Thanks for listening to our presentation, and we hope that you learned a lot about telemedicine.
Here are our resources.